Welcome. So today's video is in collaboration with the N8 Child of the North and Centre for Young Lives as part of the 2025 report campaign. So we've released a series of 12 reports across 2024 and 2025 on how we can build a country that works for all children and young people. So today we have Dr. Megan Wood with us to discuss the Autism report. Would you like to introduce yourself?
Hi, so I'm Dr. Megan Wood. I was the executive editor across the Child of the North report series, and I was the lead author on the Autism report. I'm a postdoctoral fellow at the University of Leeds, and I'm excited to chat everything through about the Autism report today.
So first question, I guess, is what exactly was the purpose of these reports?
So the purpose was to shine a spotlight on all the amazing work that's been done across the country by leading experts. In particular for the Autism report, we wanted to show what amazing work, initiatives are being done up and down the country. We want to show the art of the possible. We don't want it to be just all about doom and gloom and what the issues are. We want to almost it be a celebration of what can be possible with the right will. We also wanted to highlight, as I said, some of the amazing evidence and use this evidence to create policy recommendations that go directly back to government about what they can and should be doing to help support children and young people with autism.
Okay, so next question is, why is this report important for our communities and what kind of actions can we take from this report?
So, as we know, there's a real crisis happening in the country at the minute around the identification and the support of autistic people. And we know that, especially since COVID, there's been a 300% increase in the length of time that children and young people are waiting for an assessment. And this isn't good enough. Something needs to change, and we need that political will to get behind and do something about it at a national level. We know there's structural inequalities around the identification of individuals.
For some of our viewers who might not know what you mean by structural inequalities, how would you?
So there are biases, I guess, in terms of who might receive a diagnosis of autism. So, for example, gender inequalities, ethnic inequalities, and also socioeconomic inequalities are amongst the most prominent, I guess. So, for an example, white individuals are 50% more likely to receive a diagnosis of autism compared to their peers from maybe an Asian heritage. And that's not okay. And so we need to do something about that to address those inequalities.
So we've talked about the importance of these reports, why it's important for local communities and just widespread UK. And I guess wanting to know, what are your recommendations that you highlighted in these reports? So
through all the evidence that we've collated from leading experts up and down the country, we've created 3 evidence-based policy recommendations. One of these is about building effective partnerships, particularly between health and education. So often they work completely separately, and the child that goes to the GP is still the same child who's in the classroom. So we need to make sure that these are actually talking to each other, and we know what's going on in both of these systems, which is not currently the case. So building effective partnerships is really key to helping support individuals who we may think has autism. Secondly, we want to make sure that people have the training and the knowledge and the confidence to support autistic individuals. So this can be about increasing training, so for teachers, for healthcare providers, social care workers, anyone who's interacting with autistic people. They need to have the knowledge, they need to have the skills to do so. So we're suggesting that actually increasing access to continuing professional development, or CPD, is a really key way that we could achieve that. And then finally, similar to the first, is creating formal partnerships across services. So more generally at a ward level, they need to be specific to the community. So if there's particular demographics or socioeconomics or barriers and things like that, we need to make sure that we're actually focusing our resource and interventions that serves the needs of their communities.
So are there any key takeaways that the audience needs to walk away with?
So I think just the idea that there's hope. There's amazing work that's being conducted. There are amazing initiatives and programs to support autistic individuals, and we just need to keep remembering that there is amazing work going on. But what we now need is the political will to get behind it. We need to ensure that we have the appropriate resources, the appropriate training and knowledge, and we can't do that on its own. We really need to come together as a community to help support autistic individuals. So we've provided these recommendations, and we're really hoping now that the government step up and actually make the changes that are so desperately needed.
Thank you for being here today. That was really insightful.
No worries at all. Thank you for having me.
If you want to read the full report, then the link is in the description.